Hantavirus has been a major headline recently following the death of legendary actor Gene Hackman and his wife. The cause of her death was determined to be hantavirus, but what is it? And could you be at risk at this point? Western Mass News reporter Madison Lisowski is getting us answers.
We recently reported on the tragic deaths of Gene Hackman and his wife, Betsy Arakawa. Hackman dying from heart disease and complications from Alzheimer's, and Arakawa from hantavirus. While heart disease and Alzheimer's are more common and well-known illnesses, we wanted to get answers on what hantavirus is and if you could be affected. According to the CDC, hantavirus is spread by contact with rodents or their urine or feces. It cannot be spread between people. Western Mass News spoke to Dr. Robert Baldor of Bay State Health, who tells us that hantavirus doesn't have a rapid test like COVID or the flu, so it can be hard to diagnose.
The trouble with hantavirus, though, it's a little bit like COVID, is that for immunocompromised people, it can be really severe, and it causes a severe pulmonary condition, and we have no treatment for it.
There are two syndromes of hantavirus. The first, hemorrhagic fever with renal syndrome, or HFRS, which is found mainly in Europe and Asia. Initial symptoms include intense headaches, back and abdominal pain, feverish chills, nausea, blurred vision, and more. The second syndrome, hantavirus pulmonary syndrome, or HPS, is more commonly found here in the United States. Those initial symptoms include fatigue, fever, and muscle aches. Dr. Baldor says that in general, the symptoms for hantavirus are what experts call flu-like symptoms.
The people who really get sick are those that are immunocompromised. If you're otherwise young and healthy, you're going to be fine with it. Take some Tylenol, make sure you're staying well hydrated. When should you call your doctor if you're having trouble breathing?
He recommends that if you do come in contact with mouse feces, be sure to take care of it in a safe way.
Don't go sweeping with a broom, because what happens is this is caught by inhalation. So if you're sweeping things with a broom, the virus can get up into the air and you can breathe it in.
Instead, you should wear a mask when removing them. But the safest way to deal with it is to call in a professional exterminator. Luckily,
but again, very uncommon in the Northeast, and not the sort of thing we've been thinking about here in Pioneer Valley.
Reporting for Western Mass News, I'm Madison Lisowski.